Thank you for joining me today, Professor Holz. Firstly, could you give
Thank you for having me.
You're welcome. Firstly, could you give me an overview of some of the exciting things that will be in store for participants at this year's EURETINA meeting?
I think we're looking very much forward to this year's EURETINA meeting. Of course, because of the pandemic, it's a completely different setup. It's a purely virtual meeting, but I think we will deliver highly interesting topics, lecturers, instructional courses, symposia, main sessions, and of course, as the usual retina meeting will cover the entire span of this dynamic field of retina. And if you ask for some of the highlights, there are of course so many, I need to restrict myself, but I think we have lots of new information on the use of artificial intelligence in image analysis. There will be new therapeutic developments, both in medical and vitreoretinal retina, so in surgical retina. Gene therapy is broadening beyond just one specific target in these days. We will also inform about improvements in better patient counseling, and we will, for the first time, make public the EURETINA Roadmap 2025, which I have initiated and which we have compiled together with the board of EURETINA to make a strategic plan for the next 5 years of EURETINA. This includes, for example, the support of younger ophthalmologists moving into the retina field, and also our digital strategy, which of course with the pandemic has given a specific drive and where we have very, very specific goals to achieve over the next 5 years.
It sounds excellent. And COVID-19's obviously led to this meeting having to take place virtually, as you mentioned. How have retinal surgeons had to adapt during these difficult times?
I think all medical professions had to adapt to some degree. At the EURETINA 2020 virtual meeting, we will have a specific main session on the topic, what was the impact and is the impact and will it be of COVID-19 to all our practices, how we manage patients. And I think depending on the degree of lockdown, we all had to adapt tremendously. For example, in the era of surgical interventions, to restrict those to emergency cases and maybe postpone those elective cases that could be done later. As a matter of fact, in Germany, we basically have returned to normal, but we see increasing numbers of infected individuals, not only here in Central Europe, but throughout the world. So there may be adjustments become necessary over time. And I think specifically the anti-VEGF treatment for macular diseases had to be adapted in that we cut down on diagnostic measures to keep the time of patients in practices in hospitals at an absolute minimum. And there are several good ideas how to handle this, but I think specifically the retina community has done this perfectly so far.
Mm-hmm. That sounds great. And do you think virtual meetings will become the new normal?
Well, it's hard to predict what will happen 2021, 2022. We would all love to gather again and have face-to-face meetings. But I think there are things to stay with the possibilities without traveling and having perhaps high costs and time out of daily obligations. Hybrid meetings will be the future anyhow, so there will be a meeting, if this is possible again, if we have vaccines and treatments for COVID-19, we will have live meetings face-to-face that will be broadcasted then globally, and this is perfect. It has a much far reach and an impact on communicating new developments in the retina field. So I think this hybrid meeting and this virtual component of meetings is here to stay.
Okay, and finally, what are the most exciting current trends or developments in the retina space?
Again, there are so many exciting developments in the retina space. It's hard to restrict to just a few examples, but I think in the field of neovascular age-related macular disease, we see an enormous dynamic development in trying to get longer-acting medications. So also drug delivery systems all lends down to the issue that the burden of patients under intravitreal therapy need to come so frequently to practice in hospitals, and our outcome that we achieve by managing these patients may suboptimal. So we would love to have more efficacious drugs. We would love them to have a longer duration of action. And there we will have many examples at the EURETINA meeting that will be presented. I earlier mentioned artificial intelligence, which really is moving in the retina field, as imaging is a key component of the diagnostic measures that we do to diagnose disease early, to manage patients. And there are lots of new ideas and already far developed programs that will help physicians to make the right call, to make the right diagnosis, and have the optimal outcome with managing patients based on this new information.
Excellent. And it sounds like the meeting's going to be really rewarding to attend, and so much new information is going to come out of it. So thank you very much for filling me in on your thoughts on all of that. That brings me to the end of our interview now. But thanks again, and enjoy the rest of your day.